Hello and welcome to the Health and Counseling Center's overview presentation. My name is Sarah Robbins. My pronouns are she, her, hers, and I'm part of the administrative support team here at the Health and Counseling Center. I'm also the insurance specialist as well as the patient advocate on our team. Today, we are going to give you an overview of the services that we offer at the Health and Counseling Center, and then we're also really excited to meet you all in person during the live sessions over the summer. And with me today is my co-host.
Hi everyone, my name is Casey Johnson. My pronouns are she, her, hers. I'm also a healthcare administrative specialist and I do some of the marketing and outreach for the center throughout campus. I'm sure you're eager to learn more about the Health and Counseling Center, so let's just get started. So here's a little bit about what the Health and Counseling Center has done in response to COVID. We've kind of transitioned a lot of what we've previously been doing to still support our students. So on our counseling side, we have transitioned to telehealth appointments, and we have added some group therapy appointments for students to utilize. We have 2 specific COVID support groups. On our medical side, we have telehealth appointments available, and we are still offering on-campus appointments for different medical cases. We have also partnership with local community hospitals and urgent cares. Our Center for Advocacy, Prevention, and Empowerment are offering virtual advocacy sessions and also still available to help connect to local and national resources. Our health promotion team hosted a virtual sexual assault awareness month and have also been doing health and well-being tips via social media. Our collegiate recovery community is providing support meetings online and virtual social gatherings. As DU's Health and Counseling Center, or HCC for short, our mission is to provide exceptional, inclusive, integrated healthcare for DU students. We promote student success and wellness through education, advocacy, and outreach to the University of Denver community. All DU students, part-time or full-time, undergraduate or graduate, can use the health and counseling services. The HCC is an outpatient on-campus facility that provides a wide range of services. Our team consists of 75 plus staff of physicians, physician assistants, nurse practitioner, nurses, psychiatrists, medical assistants, counselors, health educators, administrators, and other professionals, as well as graduate and undergraduate level staff. We are made up of 6 units. Here are the 6 units. We have a medical services team, a counseling services team, a Center for Advocacy, Prevention, and Empowerment, or we call CAPE, our health promotion team, our collegiate recovery community, or we call it CRC, and our administration and finance team. The HCC offers comprehensive primary and acute care. We provide routine health maintenance exams, ongoing preventative care, and sick visits for cold, cough, sore throat, and flu illnesses. We offer on-site rapid testing for flu, strep, mono, and more. We offer same-day appointments and daily nurse triage. Our counseling team includes licensed psychologists and licensed social workers, as well as graduate student staff from both of these disciplines. Our services include one-on-one and group services to support students experiencing transition, situational problems, crisis, or long-standing mental health concerns. Both our medical and counseling services are here to support your students' transition to DU and other transitions in their life, as well as support development and growth. Our services are all confidential and no information is released to anyone without your students' written consent, except in the case of life-threatening emergencies and otherwise requested by law. When the HCC is closed, you can call the HCC and speak with an on-call medical provider or on-call counselor. So you still call our main line at 303-871-2205 and you will get prompts for either one. We also have some additional options. There is an urgent care and emergency close to DU. These are the 2 listed on the screen and can help when it is more of an urgent situation. My SSP is a supplemental program we offer that provides free 24/7 remote counseling and support to all students via the use of multiple forms of technology. This program also provides clinical advisors who speak more than 30 languages. CAPE, or the Center for Advocacy, Prevention, and Empowerment, supports survivor healing by providing advocacy and support to survivors of sexual assault, relationship violence, stalking, and sexual harassment. All services are confidential and free of charge. If you want to get in touch with a CAPE member, please use the information on the screen. Our health promotion department focuses on educating and empowering students on topics including alcohol and other drugs, mental health, gender violence prevention, and sexual health. Their mission is to cultivate a thriving DU community. They do this through educational workshops and outreach, peer education, campus-wide events, late-night substance-free activities, and using well-being information and resources. Our Collegiate Recovery Community, or CRC, is a welcoming community where you can meet other students, find sobriety-friendly social events, attend support meetings, receive guidance from professional staff, and find referrals for other resources on and off campus. Some of the benefits of being a part of this community is a community lounge, study and social network, alcohol and drug-free social events, sober housing options, support meetings, peer mentoring and orientation programs, and educational seminars and events. This is the little bungalow that our CRC is located in. For any questions, you can contact Waltrina. She is the director of the CRC directly. We do have an online platform for students to utilize here at the Health and Counseling Center's main website, which is du.edu/HCC. You can access a lot of things. This is where a lot of forms are located, a lot of answers to questions, and then in this red box, we have the My Health portal. This is where students can go to make appointments, send secure messages to their providers, and also access a lot of their immunization information.
So I'm going to jump in here and talk about everyone's favorite subject, health insurance. The first thing that you need to know is that all students are required to have health insurance. It is mandatory. So we do offer our own health insurance plan, which is underwritten by United Healthcare Student Resources. I'm going to talk a little bit about the plan, but there is far more detail on our website, and we can also answer any more in-depth questions during the live Q&A. But the basic things that you should know is that the Health and Counseling Center becomes the primary care provider for the plan. And if you need to see anyone out in the community, your student is required to come in and get referrals from our primary care providers. That includes our medical and counseling providers to see folks in the community. The health insurance that we offer here at the HCC covers students all over the U.S. and for study abroad. One of the reasons I want to mention that the students are covered all over the U.S. is because what we find is a lot of students who are coming from other states don't realize that their health insurance plan will actually not cover them outside of the state that they're in. So make sure that that's something that you're looking at. So when you're deciding if you want our health insurance or not, you're making an informed decision. So here's a little bit of the breakdown of the cost of our health insurance plan. So for the full year, it's $3,300, but we bill in two different segments. So we bill once in the fall and then once again in the spring. So for those who are on the quarter plan, you must accept or enroll in the health insurance before October 1st. If you're a law student, that date is September 1st, that you have to decide if you want to enroll or waive the health insurance plan. And then you would do that again come spring quarter, or for fall students, for law students, the spring semester. The deductible for the plan is $750. The co-insurance is 15%, and the out-of-pocket max is $1,500. So for those of you who are not familiar with insurance jargon, the deductible is the amount of money that you're required to spend before the health insurance begins to kick in. The co-insurance is the amount that the patient, or in this case, the student, is required to pay after they've hit the deductible. So once you've spent that $750, the insurance ends up covering 85% of the cost of your visits. And then the out-of-pocket max, and the most that you would spend in a policy year is $1,500. Again, this is just a brief overview of how things work, but you can go, like Casey said, our website is a wealth of information. So you can go to our website and find more details there. So we offer something called the health and counseling fee. It is $200 per quarter, or if you're a law student, $300 per semester. And for undergraduate students, it is a required fee. This is not a health insurance plan, but it is a plan that offers decreased medical care and counseling costs here at the Health and Counseling Center. So a good example is for counseling services. The regular cost for a visit is $170, but with the health and counseling fee, the visits drop down to $20 a visit. It also reduces the cost for things like labs or procedures that may be done here at the Health and Counseling Center. We do not bill to insurance, so this makes coming to the Health and Counseling Center a lot more affordable. So we also offer a dental insurance plan through Delta Dental of Colorado. So it works a little bit differently than the way the health insurance works in terms of payment. We send your credit card information over to Delta Dental, and they take out $32.07 each month. So for the full policy year, it ends up being $384.84. You can only enroll in the Delta Dental insurance in the fall of each year. There's no way to enroll partway through the academic year. Just like the health insurance, the coverage is also only available for students who are enrolled in classes. One thing that I want to mention is that you cannot enroll through Pioneer Web like you do for the health insurance. You have to manually come in. You have to provide us with the documentation by email, fax, or by postal mail, so we can then enroll you in the Delta Dental insurance. There are a few things that your students need to complete and keep on their mind. So the first is immunization records. The state of Colorado requires that all students on college campuses need to provide proof of 2 measles, mumps, and rubella vaccines. And if your student's going to be living on campus, they also need to provide proof of a meningococcal or meningitis vaccine received within the last 5 years. This is a state requirement, and you can either fax those into us or send them by email. Like I said earlier, you have to select or waive the health insurance on Pioneer Web. So underneath your students, there's a tab that says student on Pioneer Web. You're able to go and waive or accept the health insurance. Your student will be able to do that once they've registered for classes, and then the deadline is September 10th for those who are in the quarter system. So undergraduate students that date applies for all undergraduate students. And then finally, you have to decide if you're going to enroll in the Delta Dental plan of Colorado. So again, that's another thing that your student actually has to actively do. It cannot be done on the website. So we have 3 locations on campus. Our main location is in the Ritchie Center. It's pretty easy to find on campus. It's the building with the gold steeple, and it's where all of our medical services are hosted, as well as most of our counseling services. We have 2 other secondary locations. Our Asbury location also has some counseling services, but it's also where our health promotion and our CAPE, our Center for Advocacy, Prevention, and Empowerment, they are hosted there as well. And then finally, as Casey pointed out earlier, we have the Collegiate Recovery Community. It's its own standalone building that your students can go to. So on the screen here is all of our contact information. And as mentioned previously, our website is a wealth of information where you can find a lot of answers. But we're also here by phone call or email. And then we're also really excited to meet you all in person during the live Q&As and to answer all of your questions about the Health and Counseling Center. And we look forward to meeting your students come this fall. Have a great day, everybody.